Hi everyone, Dr. Triya Malde here. Welcome back to another neurodiagnostic video where today we will learn about Juvenile Myoclonic Epilepsy, also known as JME. JME is an epilepsy syndrome in which patients experience quick jerks of arms or legs called myoclonic jerks and generalized tonic-clonic seizures, and quite often absent seizures too. And sometimes in about a third of patients, the first seizure type that actually appears is the absent seizures, although not all patients will have this. Generalized tonic-clonic seizures typically appear a few months after onset of myoclonic jerks. JME typically occur around adolescents in otherwise normal children. This occurs upon awakening in the early morning or up to 1 hour from awakening. The causes of JME are very complex, not completely understood, thought to have a genetic basis. Although there is not one single gene that has been shown to lead this diagnosis, there have been few associated genes though. Some triggers have been identified as lack of sleep, extreme fatigue, stress, and alcohol. When taking history of a suspected JME patient, you should be sure to obtain time of the day these myoclonic jerks happen, if there is a family history of seizure, and any lifestyle changes that can cause patient stress. Also make sure you do photic stimulation, as 1/3 of JME patients have photoparoxysmal responses. So how do you diagnose this disorder? You should suspect in any developmental anomaly adolescent presenting with the characteristic seizures with family history and typical seizures precipitated by photic stimulation. On EEG, it will have normal background. And sometimes there is a 4 to 6 Hz bilateral polyspikes and wave discharge with frontal predominance. During a seizure, they can have 3 to 4 Hz polywave and spikes with frontocentral predominance. So this is what it looks like. With each of these spikes, there can be a myoclonic jerks. And this is generalized over the entire EEG. The best medications for JME and myoclonic seizures are valproic acid, lamotrigine, and topiramate. The first medication approved by the FDA for the JME is levetiracetam. However, if partial seizure medications such as carbamazepine and phenytoin are used to treat the JME, these agents may not only be ineffective, but in certain cases, they may worsen the seizures. So that's all about today's video. I hope you all learned and understood well. Please let me know what other topics you would like to learn from me. Till that time, take care of yourself, study hard, study smart. Bye.